For us, our approach is a tipping point. Every day we run into kids that are amazing people, that are looking for any positive, supportive adults. Every staff in the school-based health center believes in every child that comes through.
I'm the pediatrician here at Morris, and our day-to-day activities involve, taking care of the student body. We provide physical exams, we do urgent health care, we do reproductive care. We have a LPN, who's our nurse, and now we have a dental team as well. Having a dentist here has been great. I thought that kids would be running from the dentist, and it would be a hard sell to go up there and get people to come down. It is full.
A lot of our success, you're not going to see it now. You'll see it later on. The principal of Community School 55 here in the Bronx.
My name is Joaquin Vega. I'm the principal of Bronx International High School, one of the 4 schools on the Morris campus. A culture where we have one-stop shop for the students. In the past, when we have a nurse, the students didn't even know what the nurse was.
We provide, full comprehensive services for those who don't have a medical home. So it's a place where people understand the rules are a little different, and actually it's a respite for many of the kids who are in a very hectic environment from day to day. And students who just need simple things, an asthma treatment, something that they could be in and out and have the whole rest of their day to be educated. We've saved so many kids from being hospitalized. I had a girl here yesterday who has a staring seizure. The teacher saw that. They thought, oh my gosh, what's going to happen? I got her down here. I knew her from before. I called a parent, said it's fine, sent her back to class. Well, that would not have happened had we not been here. The vision part of our care right now is just screening. If we had funding to get an ophthalmologist or optometrist on site, it would really round out all of what we could do for our students. What I firmly believe is that this is the way that healthcare should be administered to children, really, is through the school. I didn't understand the real need for birth control until I started working in high schools. Very few people even cried because they didn't have a plan that didn't involve them having a baby at an early age.
With the help of the clinic, we have facilitated sex ed with students, STD testing, HIV testing. They also done pregnancy testing.
To offer options where they can access birth control, we can express to them the need for them to be in control. We had about 40 pregnancies every year. And as time went on, as we got more involved in reproductive care and providing long-acting birth control, IUDs, implants, Depo-Provera, we really saw probably that drop to about 20. We saw less pregnancies, but it does show a trend that we're helping things to improve.
Being able to dispense on site has made a huge difference. The policy work is key on creating a strong financial underpinning to be able to expand the services and also to create the flexibility to provide the breadth of services that we want to provide.
The Montefiore School Health Program has helped the self-esteem of our students by really getting in there with our students who are having trouble in school, having difficulty just managing life. We've had kids who are chronically truant. Because we gave them appointments to see the social worker, they would come to school. Environment changes everything. If you can create environments where these kids are valued, where they're understood, it changes the way that they perceive life.
The main goals of our program, it's been for over 20 years now, is to, as part of a healthcare service for children, establish an organized system of comprehensive care throughout the Bronx, mental to dental. We hope by 2020 to be in over 100 schools in the Bronx. We did a study on our elementary school asthmatic population and found that there was a 50% reduction in hospitalizations and it was a 50% reduction in emergency room use. For obesity, our community health program focuses on very specific programs to get kids more physically active and eating better. We have a program for third graders to learn how to cook 14 healthy recipes. They learn it in school. We have in-class aerobic exercise programs. We have Learn to Ride programs.
Our clinic now has helped us to reach almost 94% attendance rate.
That also correlates with parents being able to be at work more. So it stabilizes families. It helps kids be in school more, so in class more, so they can be learning longer. A 21st century health care program for kids changes the boundaries of where health care is provided. A study done by the University of Rochester showed a 60% reduction in kids being sent home from school. So that means they're in class all day long, and being in class is correlated with improved academic success. The way new private contributions can help our community and help our program. One, to provide startup funds for new clinics. We have schools calling us every week, and we need from $200,000 to $300,000 for the first year to cover that gap until we're fully functional. We need private donations for pilot programs like Recycle a Bike or Learn to Ride or cooking programs. The key for us to reach our goal is to have expandable, stable funding streams.
For the students, our goal is always to create healthy beings. Academic success is completely tied to health and well-being. What Montefiore Medical Center does is it fills gaps in the lives of children.
The Montefiore School Health Clinic is removing the barriers that prevent our students from having the type of educational experience that we expect students to have in New York.